So you've talked about the role of contributing towards assessment of level of awareness, and you've talked about helping interpret behaviours and possibly look at intervention strategies. Is there any, are those the two main roles with the patient, or would you have any other role with the patient, and we'll then move on to families?
Sometimes with the patients we might get involved with specific mental capacity assessments. It depends what issues have come up. So for example, I mean, it's often related to behaviour. So I did one relatively recently that was about a patient sort of, I mean, refusing medication isn't quite the right word because there was no evidence actually that the person really understood what the medication was or what was going on, but it might be that kind of issue comes up and we need to have a look at, you actually have to do an assessment to inform then, some best interest decision making. What we will want to do, of course, is observe the behaviour and see if there are any environmental changes. Is it time of day that's the problem? Is it the way it's presented to the person? The patient that I'm actually talking about, some of the medication was given in liquid form, and changing the flavour of something made a difference. So there might be, things like that we can pick up from our observations that we can try and see if it resolves the problem. And then, in terms of best interests, we would always obviously want to talk to family about, well, was this person always somebody who didn't want to take medication? Are they somebody who would actually find it really aversive for somebody to be, offering them this little bit of liquid? Did they have beliefs that, Western medicine was not something that they personally believed in? Because all of those things will be factoring into, the formulation of what's going on, and then, what do we do? Because if you do have somebody who is pulling at tubes or actively kind of bashing people's hands away every time they're trying to give an intervention, you've got to think quite creatively about how to work out best interests in the least restrictive way there, because it's not as simplistic as saying, well, they must have it, and therefore, one has to do some sort of restraint, because that could be very, very aversive to the person. So, there'd be a whole lot of questions that would need examining, that would need answering to really try and be sure that the outcome was truly in the best interest of the patient, insofar as, everybody concerned could be as sure as they could be in the absence of the patient being able to tell us.